Welcome to the Circle Direct podcast, to your go-to podcast for heart health. Today, we're diving into a topic that affects athletes and active individuals, arrhythmias. Now, if you have ever felt like your heart is racing, or you feel like your heart is fluttering, or you feel like your heart has skipped a beat, you might have wondered, is this normal or should I be concerned? Today, we're breaking it all down. What is normal? What is not normal? And when is it best for you to seek medical help? To understand arrhythmias in athletes, we have to first understand what is arrhythmia itself. Now, arrhythmia, simply put, it's an irregular heartbeat. This can mean that your heart is beating too fast, too slow, or erratically. When we say erratically, we mean all over the place. While arrhythmias are very common and are often harmless, they can sometimes have underlying problems that signal for these arrhythmias to come, especially in athletes, because athletes push their cardiovascular system to the limit. Athletes naturally have lower heart rate due to increased cardiovascular efficiency. What does this mean? This means that their heart pumps blood more effectively, often leading to what is called an athlete's heart. Now, when we say it's an athlete's heart, what does that mean? It means it's a condition where the heart has adapted to intense training by enlarging slightly and slowing down. So most of the time you see that athletes usually have heart rate of about 60 beats per minute. While this is normal, it can often sometimes mimic or mask dangerous heart conditions. Now, when should an athlete worry whenever they feel all these palpitations? Palpitations being noticeable heartbeats. These noticeable heartbeats can be caused by factors like dehydration, electrolyte imbalance, caffeine, or even stress. However, some of these warning signs should not be ignored. Now, if you're an athlete and experience the following symptoms, then that's along with palpitations, it is time to take them seriously. What are these symptoms? First of all, we have dizziness or fainting. This could indicate a serious arrhythmia that disrupts blood flow to the brain, causing that dizziness. Secondly, shortness of breath or chest pain, especially during exercise. This may signal that there's an underlying heart condition. Thirdly, we have irregular heartbeats that last for long periods. If you feel that your heart is beating out of rhythm for several minutes or even for hours, it's worth checking that out. Number 4, family history of sudden cardiac death or inherited heart conditions. Now, if heart problems run in your family, any abnormal rhythm should be evaluated and should be checked out. 5, episodes that happen at rest or without any obvious trigger. Now, while it's normal to feel your heart race during intense activity, maybe when you're running or whenever you're doing anything that requires you to move yourself extensively, unexpected palpitations while you are resting, those are concerning and should be evaluated and should be checked out. Now, what are the common causes of arrhythmias in athletes? Several factors can contribute to arrhythmias in athletes, but here are the most common ones. First off, atrial fibrillation. This is an irregular and often rapid heartbeat that can lead to blood clots and increase stroke risk. 2, ventricular tachycardia. That is a fast heartbeat originating from the lower chambers of the heart having 4 chambers, 2 upper, 2 lower. When it's from the lower chambers, that's ventricular tachycardia, which can be life-threatening. 3, long QT syndrome. That is a genetic condition that affects the heart's electrical system and increases the risk of sudden cardiac arrest. Number 4, electrolyte imbalances. Low potassium and magnesium levels can trigger arrhythmias, especially in endurance sports. Number 5, overtraining syndrome. Excessive training without adequate recovery can stress the heart and lead to irregular rhythms. Now, what should we look at to prevent these arrhythmias, or when is it necessary for you to see a doctor? Now, if you're an athlete or someone who exercises regularly, here are some steps to keep your heart in check. First off, you need to stay hydrated and maintain electrolyte balance. Drink plenty of fluids and replenish electrolytes after intense workouts. 2. Know your limits. Overtraining can stress the heart. Ensure you have enough rest days. Thirdly, you need to monitor your heart rate. Smartwatches and fitness trackers can help you spot any unusual changes. Next, regular heart screenings, especially if you have a family history of heart disease or unexplained symptoms. You also have to listen to your body, because if something feels off, never ignore it. It's better to be safe and get checked by a cardiologist than to be sorry. Now, what's the takeaway? Palpitations in athletes are common, but they shouldn't be dismissed if they come with concerning symptoms. Regular checkups, listening to your body, and knowing when to seek medical advice can help prevent from serious complications. Thank you so much for joining us here today at Seco Direct Podcast. If you enjoyed this episode, don't forget to subscribe, leave a review, and share with your fellow athletes. Stay active, stay safe, and keep your heart healthy.